Bismillahirrahmanirrahim. In the name of Allah, the most gracious, the most merciful. This is the day the word of wisdom is the lost property of the believer. Whoever finds it, he is the most deserving of it. I'm Dr. Mahnnor and I'm going to present evaluation frameworks under kind supervision of my professor, Dr. Saira Afzal. In this presentation, we will understand the concept of evaluation, different type of evaluation, recognize the role of evaluation in decision making, explore key components of evaluation framework, compare various evaluation models, understand data collection methods, create a logic model. At the end of this session, learners will understand the significance of these frameworks in assessing programs, projects, or policies. Will be able to recognize framework components, distinguishing between types and creating logic model. Will be able to select indicator, analyze data, and apply frameworks in real world. Evaluation: systematic process of assessing, analyzing, and appraising various aspects of our organization's performance, effectiveness, efficiency, quality, and outcomes. It involves the collection, interpretation, and use of data and evidence to make informed decision and improvements in healthcare system. It's the basic evaluation framework by Centers of Disease Control and Prevention. Criteria should be followed, including utility, feasibility, prosperity, and accuracy. There are 6 steps of evaluation framework. The first one is to engage the stakeholder, then describe the program, then focus the evaluation design, gather the data, then justify the conclusion, and at the end ensure the use and share lesson learned. These are the types of evaluation: formative evaluation, process evaluation, outcome evaluation, and impact evaluation. Formative evaluation undertaken to ensure that program or program activity is feasible, appropriate, and acceptable before it is fully implemented. It is usually conducted when a new program or activity is being developed or when an existing one is being adopted or modified. Process evaluation determines whether program activities have been implemented as intended and resulted in certain outputs. You may conduct process evaluation periodically throughout the life of your program and start by reviewing the program. Outcome evaluation measures program effects in the target population by assessing in progress in the outcome that the program is to address. To design an outcome evaluation, begin with a review of the outcome components of your logic model. Impact evaluation assesses program effectiveness in achieving its ultimate goal. It is the systematic identification of the long-term effects, positive or negative, intended or not, or individual, household, institutions, and the environment caused by given activity such as program or project. On behalf of evaluation processing, we can also divide it into formative evaluation and summative evaluation. Formative evaluation is for learning and practice, while summative is for performance. Formative can be done throughout the course, while summative one is done at the end of uh, instructional period. Formative identifies the gap and improves learning, while summative is the evidence of the performance, knowledge, skill, and proficiency. Formative evaluation approaches the sport specific needs, while summative exit learning products or cumulative assessment. Now we'll discuss evaluation design. There are 10 evaluation design. The first one is pre-post design. Involves collecting data from same group of participants before and after an intervention or program to assess change over time. For example, evaluating a fitness program's effectiveness by measuring participants. COSI experimental design compares groups that have not been randomly assigned to a treatment condition, making it less rigorous than the randomized control trial assessing the impact of smoking cessation program by comparing individuals who smoke and who don't. Randomized control trial is a gold standard design where participants are randomly assigned to either a treatment group receiving the intervention or a control group receiving a placebo or standard treatment. Case study design involves an in-depth examination of a single case or a few cases to gain a comprehensive understanding of a specific phenomenon. For example, investigating the success factor and challenges faced by a small startup company through detailed interviews, observation, etc. Longitudinal design collect data from the same individual or group over an extended period to observe changes, trends, and developmental patterns. For cross-sectional design, collect data from a diverse group of participants at a single point of time. For example, conducting a survey to examine the relationship between income levels and access to healthcare service. Cohort design follow a specific group of individuals over time to observe how exposure to a particular factor influences outcomes. For example, assessing the long-term health effect of smoking by following groups of smokers and a control group of non-smokers. Developmental evaluation is assigned for ongoing adaptive programs or interventions, for example, evaluating a community development project. Goal-based evaluation aligns the specific organizational goals and assess progress towards achieving goals. For example, non-profit progress towards increasing literacy rates in targeted community. Summative evaluation assess the overall effectiveness and impact of a program or intervention against predetermined criteria or standard. For example, determining whether an educational curriculum meets learning objectives and standard by evaluating student performance and achievements. Now we will move towards the data collection. Data collection is done by different methods which are called evaluation tools. There are two types of evaluation tools, quantitative and qualitative. The quantitative evaluation tools contain outcome measures, assessment scale, key performance indicator, performance metrics, trend analysis, regression analysis, geographic information system, sampling service. While qualitative tools contain interviews, focus group observation, document review, metrics analysis, concept mapping, mind mapping. This is a criteria of consideration of a process which is going to evaluate. The program should be and the evaluation should be relevant, coherent, effective, efficient, impactful, and sustainable. Evaluation approaches and models, systematic framework and methodologies used to assess the effectiveness, efficiency, and impact of program projects, policies, or intervention. These approaches and models provide a structured process for collecting, analyzing, and interpreting data to make informed decisions and improve outcomes. There are 10 evaluation approaches and model. The first one is utilization focused evaluation, which emphasizes engaging stakeholder and ensuring the evaluation findings are relevant and actionable. Model will encourage evaluators to tailor the evaluation to meet the specific needs and priorities of user. Second one is theory-based evaluation approach would be focusing on testing and refining the underlying theories, while model will involve examining the program's theory of change and causal pathway to assess. Logic model provide a visual representation of a program's components, including inputs, activities, outputs, while model will help stakeholders understand the program's theory and guide the selection of the key indicators of measurements. Then for one, this realistic evaluation approach seeks to understand how program work in specific context by examining the relationship between context, mechanism, and outcome. While model is commonly used to realist evaluation to explain how context influences our program's mechanism, etc. Developmental evaluation approach is used to in complex and dynamic environments, while model is for involves the continuous learning and adjustment. Process evaluation approach the implementation and delivery of program, focusing on adherence to protocol and program fidelity, while process evaluation model typically involves evaluating programs input activities output, etc. Outcome harvesting approach is a participatory approach that captures outcomes and changes as they merge through the collection of stories of changes. Uh, Outcome harvesting model narratives from the program participants stakeholder to understand the impact of intervention. Responsive evaluation approach is flexible and adaptive, while model involves continuous feedback and adjustments. Empowerment evaluation approach encourages the involvement of program stakeholders in the evaluation process, while model is to take ownership of evaluation, make decision based on their insight, and drive program improvement. CIPP evaluation context input process product uh, is a comprehensive framework for assessing different aspects of program. Model is evaluated to provide a holistic view of program effectiveness. Now there are evaluation frameworks. There are total four evaluation framework: conceptual, result framework, logic model, and logistic framework. The first one is conceptual evaluation design. Conceptual evaluation design is an initial high level plan that outlines the key components, relationships, and process of an evaluation. It provides a framework for how evaluation will be conducted and what aspects will be assessed. Strengths of this design is it provides clarity, guidance, alignment, early stakeholder engagement, and flexibility. My limitation of this evaluation design is there is lack of specificity, potential for misalignment, the scope oversimplification, and limited guidance to for implementation. Here's the example and step for formulating a conceptual evaluation framework. First step is input that could be in form of funding and resources, program planning and design. Activities will be containing implementation of health intervention, outreach, and education program. The third step is output: number of health workshops conducted, educational material distributed, number of community members reached. Fourth one is intermediate outcome, which will increase knowledge of health behaviors, enhance community awareness. Fifth step is long-term outcome, will increase access to healthcare services, strengthen community health capacity. Sixth one is external factor, which will include socioeconomic condition, policy, environment, cultural factors. Seventh step is to evaluate evaluation method, which will be done through surveys, questionnaires, health outcome data analysis, key information interviews, etc. Eighth one is evaluation: to what extent have the health intervention been implemented or planned, what changes in knowledge and behavior have been occurred in community, what are the long-term health outcome associated with interventions. Ninth step is assumption: adequate funding and resource are available, community engagement and partnership are strong. Tenth step is contextual factors, which will include urban rural setting, demographic of target population, availability of healthcare facilities. The last step is stakeholder engagement, which will include communication member, healthcare provider, local government, etc. Second one is result evaluation framework. Our result evaluation framework is a structured approach to assess the outcome and impact of a program, project, or policy. It focuses on determining whether the intended results and goals have been achieved, measuring the effectiveness and efficiency of the intervention, and providing evidence-based insight for decision making. Strength of this framework is it is outcome oriented accountability, informed decision making, resources allocation, learning and improvement, stakeholder engagement. While limitation of this framework is there is time and resource intensive complexity, data collection challenges, subjectivity, short term focus, resource constraints. There are the result evaluation designs steps. First one is, and the study we are considering over here is the obesity, childhood obesity prevention program. First step is program description. Our community-based healthcare program has been implemented to reduce childhood obesity rates in specific regions. The program includes various interventions such as nutrition, education, physical activity, motion, etc. Second step is result evaluation and objective. For example, to assess the program's impact on reducing childhood obesity rates in targeted population, to identify any unintended consequences or disparities in program outcomes, to provide evidence-based recommendation for program improvement and future iteration. Third one is key result indicators will include reduction in child obesity rate, improved dietary habits, parental involvement, health, education effectiveness. Fourth one is data collection method, which would be either pre or post surveys, anthropometric measurement, focus group review of a program record. Uh, the fifth step is analysis and reporting, in which we will analyze quantitative data using statistical methods to determine change in obesity rate, dietary habits, and physical activities. Qualitatively analyze focus group data to identify themes related to program experiences and areas for improvement. Prepare a comprehensive report that presents evaluation finding, including the impact of on childhood obesity rate, effectiveness of program components, and recommendation for program enhancement. The last step is stakeholder involvement. Engage program participant, parents, healthcare provider, and community leader throughout the evaluation process to ensure their perspectives. Uh, Third one is logistic model of evaluation. It is a visual representation of framework that outlines a logical connection between a program, intervention, projects, input, activities, outputs, outcomes, and goals. It provides a systematic and structured way to depict how a program is expected to work and what it aims to achieve. Logic models are commonly used in evaluation to clarify program theory, guide the selection of evaluation indicator, and communicate the program logic to stakeholders. Strengths of this program are clarity and visualization, planning and alignment, measurement and evaluation, communication and accountability. By limitation of logic model of evaluation as simplification, assumption based, outcomes, linear representation, resource intensive, limited contextual understanding. Here are the components of logic model. First one is input. That input will be processed and will be converted into output. Output will help to make or evaluate outcomes, and outcome will impact. In inputs, planning, appropriate space to conduct session, time to prepare for participate in session. In process, each YFHS conduct two collaborative learning session. Output will be in terms of result, and outcomes will be participant reported benefits including increased adolescent health knowledge and skill, improve teamwork and cooperation. The impact would be in form of usage quality and youth friendliness of service assessed. Fourth one is logic framework of evaluation. A logic framework of evaluation, commonly known as log frame, is a structured planning and evaluation tool used in project management and evaluation. It provides a systematic logical representation of a project or program goals, activities, output, outcomes, and indicators, strengths and limitation of this evaluation design and framework is same as that of logic model. uh, Logistic matrix framework. First of all, project description will be done, then objectively variable indicators will be identified and achievement will evaluated, then sources and means of verification would be done and assumption will be made. Project description includes goal, purpose, outputs, and activities. Is a simple example where a patient and engagement monitoring and evaluation framework is formed, where the objective is the patient safety, input is expectation, participation, resources, activities, process are structure, management, and interaction, satisfaction, learning changes are learnings and changes, impact of that is the medicine development, study quality and efficacy, and stakeholders. Here is the comparison between monitoring, evaluation, and audit. Monitoring check progress, inform decision, and remedial actions, while evaluation assesses the progress and worth, identify lessons and recommendations. Audit ensures the compliance and provide accountability. Monitoring is can be done anytime during the project, while evaluation is done at the end of project, and audit can be done during and at the end of project. Monitoring is done by internal resources, while evaluation is done by external organization, and audit can be done by internal and external one. Monitoring focuses on inputs, activities, outputs, while evaluation focuses on outcomes, and audit focuses on inputs. Monitoring is more used for continuous improvement of project delivery and performance, while evaluation is used in learning, accountability, and audit is used in quality assurance. Here are the advanced studies. First one is evaluating the public health impact of a health promotion intervention. The aim framework. Progress in public health and community-based intervention has been hampered by the lack of comprehensive evaluation framework appropriate to such program. Author proposes a model termed the aim model, that assess five dimension: reach, efficacy, adoption, implementation, and maintenance. Discuss the issues and evaluating each of these dimension and combining them to the determine overall public health impact. Summarize strengthens the limitation of the re-aim model and recommend areas for future research and application. The second research is on evaluation framework for health promotion theory, quality, and effectiveness. This article presents a framework for evaluation that has been developed over a number of years within the context of evaluating health promotion programs as part of the work of our National Health Promotion Agency, bringing together the full range of evaluation need from the perspective of all different stakeholders. Now we will move on our last session, MCQs. You are tasked with evaluating a community based nutrition program. The program aims to reduce malnutrition among children under the age of 5. What component of evaluation framework will help you specify the intended outcome related to child nutrition? A. Inputs. B. Outputs. C. Goals. D. Activities. Sorry. E. Indicators. Answer is C. Goals. You are leading an evaluation of an environmental conservation project. Your objective is to measure the impact of project on local ecosystem. Which part of the evaluation framework will guide your assessment of ecological changes? A. Inputs. B. Outputs. C. Goals. C. D. Activities. E. Outcomes. Answer is E. Outcomes. Third MCQ, you are evaluating a public health campaign aimed at promoting health lifestyle. You want to identify the specific measurable criteria for assessing the success of campaign in changing behavior. What component of framework addresses this? A. Inputs. B. Outputs. C. Goals. D. Activities. E. Indicators. Answer is E. Indicators. For once, you are evaluating a disaster relief project that provides emergency food supplies to affected communities. You need to specify the resource allocated to projects such as funding, personal, and food intervention. Which component of evaluation framework addresses? A. Output. B. Goals. C. Input. D. Indicators. E. Activities. Answer is C. Inputs. Fifth one is you are conducting an evaluation of an educational program for at-risk youth. You want to ensure that program's activities align with its intended outcomes and objectives. What tool or frameworks can help you visualize this alignment? A. Logic model. B. SWOT analysis. C. Cost effectiveness analysis. D. Program budget. E. Stakeholder analysis. Answer is A. Logic model. Six MCQ, you are evaluating a community development initiative focused on improving access to clean water. You need to determine whether the program's activities are effective delivering clean water to household. Which component of evaluation framework will guide this assessment? A. Input. B. Output. C. Goals. D. Activities. E. Outcomes. Answer is C. Sorry, B. Outputs. You are assessing the effectiveness of new employee training program in a company. Your goal is to identify area where the program can improve before it is fully implemented. What type of evaluation are you conducting? A. Formative evaluation. B. Summative. C. Process evaluation. D. Impact evaluation. E. Logistic evaluation. So the answer is A. Formative evaluation. MCQ 8, you are conducting research on user preferences for a new mobile app to collect in-depth insight into user experience. Which data collection tool allows for open-ended responses and probing questions? A. Interviews. B. Surveys. C. Experiments. D. Observation. E. Questionnaires. Answer is A. Interviews. 9 MCQ. You are assessing the effectiveness of a new customer service training program in a retail company. Your primary focus is on measuring improvement in customer satisfaction score after employee complete the training. What type of evaluation is this? Affirmative, B. Summative, C. Charlie, D. Impact, E. Conceptual. Answer is B. Summative. You are leading an evaluation, last and 10th MCQs, you are leading an evaluation project for a community-based health intervention aimed at reducing childhood obesity rates. You need to select an appropriate evaluation framework to guide your assessment. Which CDC framework is best suited for this purpose? A, the CTC Health Impact Pyramid, B, the CTC Social Ecological Model, C, the CTC Program Evaluation Framework, D, the CTC Framework for Program Evaluation Public Health, E, the CTC Logic Model. Answer is C, the CTC Program Evaluation Framework. Here is MCQ key. It is the link of our channel on YouTube. Kindly like, comment, and subscribe. Thank you.